So I'm a registered social worker in Ontario, and part of my role is to meet with patients, their families, or their support systems at bedside when they're admitted into hospitals. So I'm an inpatient social worker. There's also outpatient as well. So an inpatient social worker, we're dealing with, um, I just got diagnosed with cancer for the first time. How do we navigate that big emotion? I just lost my leg. What is life going to look like now? So we deal with a lot of the rehab patients in my department, and then there's other units as well, NICU, pediatrics, child and youth mental health, but I'm in medical rehab. Biggest surprise, third day on my job, and I was involved in medical assistance in dying. And I had no idea social workers were really involved in that. I truly thought that um, medical assistance in dying maid was more primary nurse, the primary physician, and patient and their family if involved. And that's it. I didn't think that I was actually going to be so involved in maids. And I was pleasantly surprised on my third day on the job that we were going into a patient's room and we were going to do a social work assessment to see what was life like before your admission, and why do you want to have medical assistance in dying. So there were a few things that I was really surprised by that we would do at bedside, but it's actually turned out to be one of my preferred things about my role, because I'm so honored that I'm there fulfilling someone's last and final wish. So yeah, it's sometimes heavy, but it is really rewarding as well. So it's a pleasant surprise. It can be hard. Sometimes it can be very heavy to sit with patients for good 2 to 3 hours sometimes, and trying to find the right supports for them, trying to talk to a family member about end of life services and navigating what life will look like for them afterwards. I feel very selfish saying this, but I think it's when you have a patient or a family member say, I'm so thankful that I met you. I'm so thankful that you've been here checking in on me, um, giving me this psychoeducation, providing comfort care, fulfilling my last wish. Whatever it may be, sometimes it's simply just being there to listen to them, hold their hand and cry with them. That is honestly probably the most rewarding aspect of my role. Listen to what your professors are saying. Actually get involved on campus and in class, and really immerse yourself into the knowledge that they have. Just soak up as much information that these other professionals can provide for you. Because when you get out into the real world and you're the professional and folks are coming to you, you're going to look back on these 4 years and you're going to say, oh, I remember this from that class. I'm so happy I was able to listen to my professor. I'm so happy that I was able to do this role playing class, because it will take you far. It's not about sitting and doing little lecture notes. Get involved in class. Actually get involved and learn.